I'm glad to be with you here today because I know that you, like me, are heartbroken over the number of students, families, and educators traumatized by acts of targeted violence in our schools, and that you're also here to do something about it. My name is William Braniff, and I'm the director of the DHS Center for Prevention Programs and Partnerships. While many of my colleagues focus on physical security, response, and recovery, our mission includes providing financial and technical assistance to help school systems prevent targeted violence before it ever manifests as a grievance-fueled school shooting, a premeditated hate crime, or an act of terrorism. Specifically, CP3 takes a public health-informed approach to targeted violence prevention. For over 3 decades, the public health community has studied violence prevention programs regarding self-harm, violence against children, and intimate partner violence. We are applying what they have learned to targeted violence, including school-based violence. And importantly, we are bringing those professionals to the table, providing familiarization training on targeted violence, and asking them to partner with us. Together, these multidisciplinary partners are able to create referral systems and support networks that can support early interventions for individuals ideating about violence or fixating on previous school attackers. For example, you will hear a lot about behavioral threat assessment and management teams throughout the summit. CP3's field staff regularly provide training on BTAM, but we emphasize integrating public health resources into BTAM teams and tethering BTAMs to referral networks to create additional opportunities for case management and to decrease bystander hesitancy around reporting. Through CP3's Targeted Violence and Terrorism Prevention Grant Program, CP3 has funded teams that have conducted 1,172 individual-level interventions over the past 4 years, many of which involved high school and college students. These BTAM teams provided direct services in 65% of cases, including mental or behavioral health counseling, school or workplace accommodations, conflict resolution training, and job training or skill development. In 35% of cases, they referred individuals externally. 54% of those referrals were for mental or behavioral health, and 16% for social services. And because BTAMs allow for alternatives to investigation, only 6.5% of cases opened by our grantees resulted in a referral to law enforcement for a potential criminal justice investigation as a result of legal duty to warn requirements. While BTAM teams are important safety nets for individuals gravitating towards violence, many schools are partnering with CP3 to prevent violence even further upstream. For example, CP3 sponsors the Invent to Prevent program, in which high school and university students create their own locally tailored programs to create a culture of violence prevention. Over the past 4 years, more than 1,200 students representing 119 universities across 34 states and 138 high schools from 26 states have participated in the program. These public health-informed programs tend to be strengths-based, meaning that students identify positive ways to build on the characteristics that make their school community healthy and empowered, and use those strengths to crowd out the attractiveness of targeted violence as a solution to a problem. Some student teams focus on social inclusion to decrease social isolation, bullying, or dehumanization, all risk factors for violence. Some teams focus on mental wellness and coping skills, civic debate, and the establishment of meaningful relationships between youth and adults, all protective factors that foster nonviolence. In spring 2024, our collegiate winner was the University of Maryland College Park with their InfoASIS program, which provides students with media literacy skills needed to engage with digital content thoughtfully, critically, and responsibly. The high school winner was Penn Manor High School. Their Friday Fun program provides dedicated time for students and teachers to engage in pro-social activities to decrease stress and social isolation. Importantly, many schools choose to sustain these programs because of the positive effect they have on violence prevention and student culture, and because of their cost effectiveness. Finally, I just wanted to provide you with information on the federal government's Prevention Resource Finder. This website is a one-stop website for you to access government-produced and funded training, funding opportunities, and evidence-based resources. At CP3, we update this website every other month, so I hope it will provide you with ongoing value as you spread the word that targeted violence is preventable, that everyone has a role to play, and that we are here to partner with you. Please check it out at dhs.gov/prevention. And to connect with CP3 to learn more about BTAMs or the Invent to Prevent student competition, please visit our website at dhs.gov/CP3. Thank you.